My name is Jude Otero. I am an alum from the UNM College of Pharmacy. I graduated in 2009 with my PharmD, and I currently work as the Healthcare Supervisor for Walgreens, Area 21, covering the majority of New Mexico and Amarillo, Texas. Originally, I was attracted to the profession because my sister was a pharmacist. She graduated from UNM in 1999. She was one of the last BS grads classes that the college had, and just that sparked my interest. But what really drew me in was the ability to work a job that I knew was going to be secure and be able to work within like a 40-hour-a-week sort of schedule. Later, though, I think what's interesting is those things sort of went away, and I think it was the ability to use my knowledge of medication therapy management and just disease state management and be able to make a difference for even like one person. It is always about the one for me. So there's so much to be proud of in the profession of pharmacy. We are a resilient group, and we've been continuously evolving. We see that to this day. I think for me personally as healthcare supervisor, and in my time with my 16 years with Walgreens, what I'm excited about is the ability to help position people to be most effective and to grow as leaders. So I have the unique ability to get to know my team members and understand their desires and their passion and what drives them, and pair that with what we have available and just position them for success. And the beauty of that is seeing a pharmacist flourish and then seeing patients well cared for. That's a great question. It's a challenging question, but at the end of the day, I think there's not one thing that comes to mind as far as a struggle or a challenge or a barrier, whatever you may call it, right? I think at the end of the day, I try to look at each situation that may be difficult as an opportunity to learn and to problem solve and to come out with new skills gained on the other side that will help me be more effective in my role and in my career. So here's the thing, right, is things and situations are going to change. The circumstances will change. The profession will evolve, which is awesome. I think at the end of the day, my biggest piece of advice for somebody considering pharmacy school or finishing up their curriculum with didactic education and in those components of the program would be to stay focused, not be distracted by the noise that's either in media or the noise on social media or the noise even of your peer group. Although there may be value in what they see and what they're saying, you have to dig back to what got you to be interested in pharmacy and in the profession. And if you're focused on that, if you could isolate what matters to you and use that as fuel to drive you forward, the ability to make an impact for patient care is endless. No matter what your setting, no matter who your employer, no matter where your geo is, right, where you're located, I think we could have a huge impact on a patient's outcomes if we stay focused. And we want to position ourselves for our own development and position ourselves to be successful, but always, always keep that patient in mind. I feel it's important to invest energy and time into student pharmacists, and specifically the UNM College of Pharmacy, because to be quite honest, I never thought I'd be sitting here in this chair sharing my experience with you all. I never thought I'd be a part of the Dean's seminar series. But I think I have a fair amount of experiences that I'd like to share and help students identify that no matter where you are right now, it doesn't limit where you can be a year from now or 5 years from now or 10 years from now, because situations change, people grow and develop, and even though you may feel your story is not quite groundbreaking or revolutionary, whatever term you may use, I feel like we all have value to share and invest in students and in the advancement of the practice. And it's a collaborative effort. It takes many skill sets, it takes many approaches, and it takes passion for us to link arms and move forward together to best care for our profession and for our patients. To me, the future of pharmacy is a refinement and an advancement of where we are right now. So over the past couple of years, we've been able to step into processes that we weren't used to, testing for COVID in the pharmacy, testing for flu in the pharmacy, and it helped accelerate the focus and energy around patient-centered services. To me, I think that that's going to be different dependent on practice setting, but I think what's important is that we continue to forge forward with the pharmacist being able to connect with the patient in a meaningful way that is going to help promote access to care, promote equity in services, and to promote outcomes for that patient that will benefit their overall health.